Hi everyone, this is my new topic and my new channel saying Life in Ortho, where I'll be discussing with you the basics and my learnings of ortho as well as life, and I'll be teaching you, and I hope that you gain something out of it and I gain something out of it as well. So let's begin. So orthopedics. What is orthopedics? Orthopedics is a branch of medicine which is been subdivided long back, and this is a branch dealing with the bones and joints. So basic funda is what is a bone, what is a joint. Now bone is a skeletal tissue, or you can better rhyme it, musculoskeletal tissue derived from the mesoderm and leading to strength to the mechanical strength to the body. Okay, so this is the structural component. Okay, and now what is a joint? जो तुम सोच रहे हो वो वाला नहीं. Our basic joint is a junction of two bones basically. And why is it a joint? Because it allows for movements. And this is the best part, that combining this, your whole, you can do locomotion along with your hand movements. Your daily movements are guided by orthopedics basically. So say thank you. Okay, now so let me show you a basic. So we'll be discussing about these things together a lot, but let me tell you, so basically the basic investigation for any orthopedic terminology or anything is an x-ray which is being shown in front of you. So this is an x-ray of the knee joint, okay, which is the largest joint of the body. So I just told you it is the junction between two bones. So the basic funda is, this is called femur. You already know, you are very genius people. I am the one which is going to revise it and all. So this is called tibia. This one is called fibula. And something you can see over here, this is patella. Okay, so basic example I am giving. Today's class is just an example of a first video, and the rest will follow if I get some likes and subscriptions. So please be sure to like it and subscribe. I'll be really happy. So knee joint is a type of hinge joint. हिंज समझते हो, जैसे दरवाजे की हिंज होती है जो एक उसमें मूव करती है प्लेन में. सो देयर इज यूनिप्लेनर मूवमेंट. व्हाट डू यू मीन बाय यूनिप्लेनर मूवमेंट? It occurs in one plane. Now what is a movement? Movement is conversion of muscular energy into physical form. And there are usually, जैसे हमें मैथ्स में पढ़ते थे ना, x axis, y axis, z axis, ऐसे ही there are 3 axes of movement, which is the axial plane, the sagittal plane, the coronal plane. फैंसी वर्ड्स मेरे को भी सीखने में बहुत टाइम लगा था, पर कोई बात नहीं, मैं तुम्हें समझाऊंगा अच्छे से. ठीक है, तो देयर आर 3 एक्सेस ऑफ मूवमेंट, एंड देन देयर इज समथिंग नोन एज डिग्री ऑफ फ्रीडम. दैट ऑल्सो वी विल डिस्कस इवेंचुअली. सो देयर आर डिग्रीज ऑफ फ्रीडम अलॉन्ग विद एक्सेस ऑफ मूवमेंट. So it is a uniplanar movement in the knee joint, suggesting that in one plane, which is the flexion and extension plane. Okay, so अब कहाँ से आया ये वर्ड फ्लेक्शन, एक्सटेंशन? ये सब आया एक कॉन्सेप्ट से जिसको बोलते हैं anatomical position of the lower of the body. So you must have read in your anatomy, that there is an anatomical position जिसमें सारे organs, सारे के सारे structures are aligned in such a way that you can describe their position relative to, again I said, the axis. मिडलाइन से दूर, मिडलाइन के पास, फ्रंट, बैक. तो हम यहाँ पे शानी टर्म्स यूज़ करते हैं. हम फ्रंट बैक यूज़ नहीं करते, हम वेंट्रल और डॉर्सल यूज़ करते हैं, क्योंकि हम मेडिकोज हैं. हमें दिमाग ख़राब करना ही है बच्चों का. कभी उनको आसान चीज़ें तो पढ़ानी नहीं, तो तुम्हें मैं पढ़ाऊँगा आसान चीज़ें, ठीक है. So as we discussed, it is flexion and extension. So originally the knee shows you around 140 degrees of flexion, and thanks to this flexion and this extension you are able to walk. Okay, I think we'll discuss about the knee. Okay, you want to discuss more? So एक टिप, तुम्हारे बूढ़े लोग, तुम्हारे ग्रैंड पेरेंट्स will complain of knee pain, okay, and you are not an orthopedician, so you won't be able to guide, but I'll tell you how to guide them. So tell them that first of all, weight management, okay, if obesity and everything is going to be there. Then secondly, advise them to get an X-ray done. X-ray of the knee joint in antero-posterior view and lateral view. Okay. Then how to read that X-ray? I'll put a video down for you to make it easy for yourself to read it and then describe them the best treatment locally which you can. Otherwise you'll have to shift, or if you'll have to send it to an orthopedic friend or someone or your teacher, but I'll teach you how to read that X-ray. Okay, so we'll discuss about OA in another video. Okay, I think we'll wrap this up as it is my introductory video. So hope to see you again very soon. Thank you. Good night. Bye-bye. All the best.